I had an interest in doing research. So this is my first research project I've been working on, and I reached out to Dr. Brooks. And so we've been conducting research on the role of a culture broker, which we'll get into today. And so, like after graduation, I'm not sure what I'm going to do, but I'm interested in working with queer youth, whether it's clinical or not, and then also human rights or green social work and policy. Um, and so, to give a bit of context and background on our study, over 120 million people have been forcibly displaced globally, with the number expected to continue to rise. And refugee and asylum seekers face higher rates of psychological distress as a result of their migration journeys and stressors adjusting to a new country. And as a result, many of the individuals are at risk of long-term mental health issues after resettlement and are less likely to seek treatment compared to the general population. And so our study, we aim to explore the role of a culture brokers or culture brokers in engaging refugees in mental health treatment and identifying the barriers and facilitators to mental health treatment. And so a definition for a culture broker is someone who shared both the mainstream culture, in this case the United States culture, and various subcultures, in this case the refugee culture. Those in the subculture participate in certain mainstream activities, in this case engaging in mental health services and treatment. Our study design was qualitative in-depth interviews via Zoom. We had a total of 15 interviews with 10 of the participants identify as culture brokers and 5 of them identifying as key stakeholders, um, which are community leaders, refugee mental health managers, or field experts. And the participants had to live in the US for at least 5 years and be in their role for at least 1 year. And so we had a range of participants from various countries. And on average, we had 11.3 years of experience, with some participants only having one and one participant having 30 plus years. So for our methods, we did recruitment from July to August 2024 using purposive sampling through refugee resettlement communities in the northeastern United States. And then we had semi-structured interviews via Zoom and different questions focusing on mental health, the barriers, facilitators, and the role of culture. And so our data analysis included audio recording each interview and having them transcribed. And then we each individually analyzed the data using line-by-line coding and grounded theory technique and comparison. And then we came together and developed our project codebook. And so the 3 themes that were emerging, these are our preliminary results. But the first one was the manifestations of psychological distress. So how did these symptoms show up? What barriers did refugees face, and how in search of finding mental health treatment? And then culture broker as a bridge to healing. So Dr. Brooks is going to go more in depth into those themes.
Thank you. So one of the first themes that really emerged through a lot of the analysis that we did was this whole sense of manifestation of psychological distress. So this theme was really associated with how being forcibly displaced is related to a wide range of pre-migration and post-migration stressors that ultimately contribute to a range of mental health symptoms. And so from the participants that we interviewed, they mentioned that the refugees and asylum seekers that they worked with shared a wide range of symptoms that included anxiety, depression, and trauma-like symptoms, as well as some somatic symptoms as well. And so working with the refugees and asylum seekers, many of these psychological distress or symptomology came from a handful of pre-migration stressors that include just the grief and the trauma of leaving home, the exposure to violence throughout displacement, persecution, and having basic needs such as food and shelter not being met. And in addition to prior to coming to here to the United States, when they arrived here, they also encountered a wide range of post-migration stressors as well, which including the culture shock or this whole sense of having to understand the new culture, employment and financial stress, having to work, having to support themselves and their families financially, language barriers, and this whole sense that because this situation is new, that they do have to rely on others. And so this kind of theme, ultimately, what we got from it was that being displaced and settling in the U.S. is a traumatic and stressful experience. And I wanted to share one quote or an excerpt from one of the participants that we interviewed, was a refugee behavioral health manager from North Africa, who has been working as a behavioral health manager for 10 to 20 years. So what he said about working with refugees and asylum seekers: life is very difficult in the United States based on what all my clients have been telling me. They face like financial hardships, the regulation of employment is very strict. People have to work sometimes 2 jobs just to provide for the family. All these things, being away from the family, leaving behind their years of their life, their childhood of their youth, arriving already traumatized because of what they have gone through, political uprising or like war, since they are coming from the war zone. So they have that trauma that they carry inside them. That trauma, and when they arrive, that's when they can show you that they are stressed, they're anger. You start seeing them feeling anxious most of the time, depressed and struggling. So another emerging theme that came up was this whole sense of trying to navigate treatment to address some of these mental health symptoms. And so from our participants that we interviewed, they mentioned that refugees and asylum seekers tried a wide range of methods to really and face many barriers in search of relief from their mental health symptoms. So some of the steps that are taken to respond to the psychological distress among refugees and asylum seekers. Some had this whole sense of that, hoping that the symptoms would subside on their own, so really managing them on their own. Some sought more of a cultural or traditional forms of healing, and others would seek support from friends or family members. But throughout this process, there's been also a lot of barriers to care as well, especially formal mental health care. And some of the folks that we interviewed mentioned there's a big stigma surrounding mental health, lack of transportation, having to be put on wait lists for services, having to pay out-of-pocket expenses, and this whole sense of trying to connect to what the mental health symptoms is, and having insight towards that, which we kind of identify here as mental health literacy. But there was also a wide range of facilitators to care as well, especially in search of mental health treatment, especially if you had providers who spoke the same language, family members or community members who were supportive as well, and this whole sense of having a cultural broker that advocate and connect you to services. And so I do want to highlight one of the topics that was mentioned a couple times was this really large role that the stigma or mental health stigma had in a lot of participants that interviewed. And so I just wanted to read this excerpt from a participant that we interviewed, who's a Bhutanese refugee social worker who's been in this field working as a mental health professional for about 5 to 10 years. One example that if I'm going through a treatment, and if anybody knows that I'm going through this treatment, and then they will tell the other people, what happened to this guy? He looks very good, but why is he getting the mental health treatment? What happened? And then they will figure this out, and then is he involved with some other activities? Is it something that happened to his family? And so they will talk a lot about me, meaning the refugee, in the community. So that triggers me that why I am a matter of talk. So just to prevent people from talking about me, I don't want to be exposed. I don't want to identify myself as a person who is getting the mental health treatment. And so one of the last emergent theme that we found was this whole sense that cultural brokers can be a bridge. And so cultural brokers, as just like a reminder, is someone who shares a refugee or this asylum seeker culture and language to a certain capacity, and also is familiar with culture and life here in the United States. So a lot of the participants that we interviewed, some of the characteristics of someone who is an effective cultural broker is it includes the sense of support and trust, the sense of having a shared language, having a shared culture as well, but also having this expertise or knowledge of mental health that not only focuses on the Western culture, specifically here, but the home culture of the individual as well. And they also provided a source of support and is very personable as well. And cultural brokers played a variety of roles to support this access or this encouragement to seek help for mental health. But what we heard from a lot of the participants that we interviewed is this whole sense of advocating, connecting to resources, expanding social networks, including the refugee community at large, providing mental health support and services, and just providing a sense of guidance into the unknown. So what to expect when seeking help for mental health and so forth. And many of the cultural brokers that we interviewed were refugees or immigrants themselves, so they're really passionate about the work that they did, especially this whole sense of being motivated to give back to the community of where they're from and to help just to reduce a lot of the stress that they have experienced. And so I just wanted to have a quick excerpt here. This is a Somali refugee caseworker who's been working as a mental health professional for over 30 years. And so what they mentioned was actually a broker to me, it's a very important role. It's to be someone who understands both cultures, someone who is assisting but not forcing, someone who is partnering with the newcomer and helping them to grab their hand and to help them cross that bridge and to connect them with where they want to go, but not someone lecturing them, not someone pushing them with a lot of information that they do not understand, but someone who is willing to listen and believing the differences and helping this person with a level of understanding or level of willing to learn the new. Sure. And I'll pass this to Ali.
So, the conclusions that we have found is that displacement is linked to a broad array of pre and post migration stressors, which contribute to the overall mental health and well-being of these refugees. And the theme suggests that refugees face a range of barriers when seeking care, such as stigma, fear, lack of trust, language barriers, which are likely to contribute to the low engagement rates among refugees and asylum seekers. And we think that future research should explore the potential of culture brokers as a intervention to improve refugee mental health access and outcomes. And so ultimately, we believe